It is 6:10. For some people, aches and pains are more than just a long day or a part of getting older. When the discomfort lingers for months and there's no clear answer as to why, doctors say it could be a condition known as fibromyalgia. In this week's Ask the Expert, 7 News anchor Kelsey O'Donnell spoke with a doctor from Bon Secours about why it can be so hard to diagnose and what treatments are available.
It's a painful condition that health experts say affects about 2 to 4% of people worldwide.
Fibromyalgia is a chronic pain syndrome that does not have any tissue damage or inflammation. So it's anybody that has pain for 3 months or longer in multiple parts of the body.
Doctors say finding a definitive cause can be challenging.
The source of pain in fibromyalgia is centralized pain. What that means is it's not originating in external body parts. It's originating in your central nervous system.
Dr. Mona Idris says that can look like persistent pain in different parts of the body, such as the neck, shoulders, or arms, even when tests don't show any obvious explanation.
So generally speaking, untreated fibromyalgia will not worsen, but it will start encompassing more and more parts of your life. So it can start causing mental fog, it can decrease your productivity, difficulty being able to get to all your things that you need to do in your day. Work can decrease, your ability to function at your optimal level will decrease.
Doctors say the condition is more than just pain, with many patients also experiencing sleep problems, fatigue, and difficulty concentrating. While there's no single test to diagnose fibromyalgia, doctors say ruling out other conditions is an important first step.
Just because we can't find something right now does not mean it doesn't exist or it's not there.
Experts say treatment can include lifestyle changes, stress management, improving sleep, exercise, and medication to help reduce pain.
We can also go to pharmacological treatments, which include medications that are designed to decrease that sensation that's traveling to the brain from our body, carrying pain sensation.
Doctors say living with unexplained pain can be stressful, and that stress can make symptoms worse.
Stress 100% worsens fibromyalgia, and again, pointing out the biggest source for stress in a fibromyalgia patient that will further worsen their symptoms is the fact that they cannot identify a root problem. They can't get an answer for why they have pain. Listen to your body. If you're feeling something is not right, please get it checked.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
Doctors say there is currently no cure for fibromyalgia, but the condition can be managed. They say flare-ups can be triggered by stress, poor sleep habits, or other factors, and recommend working with your doctor to find the treatment plan that works best for you. You can submit a health topic for our Ask the Expert series. Just go online to WSPA.com.